What's up, good people of the internet? Today we're doing another video. This is slightly different than our usual interview slash podcast discussion things that we've been doing in the past. Um, I have compiled some of the Reddit posts and articles that I've like read in the past, and kind of saved up on the side. And what I'm going to try to do is I'm going to show this to Anthony and Matt over here, and we're going to try to get like the raw reactions to this, right? And maybe have some discussions on it and see what they say. And it's going to be quick. Some of them stuff, we're probably not going to get through like too in depth onto it, but I think it'd be pretty fun to do it. Um, any things you want to guys want to add to this, or you guys want to dive right into it?
Let's go, baby. We have no idea what this man's gonna come out, what's gonna come out of this man's mouth.
All right. So the first one, I think I've kind of like leveled it, like I tiered it as like a lighthearted, There are some Adam Meakins post as well, like that he has like shared that has like, caused some controversies, right? So I'm not gonna say much on that. That will come as it goes, right? And I think Anthony have mentioned that he may be like hopping off. Hopefully, we wrap this up within an hour, right? Anthony saying like, he may be hopping off in a half an hour, but I wanted to I we convinced him to stay here. Like,
I
yeah,
got
we
Well,
something.
yeah, I have till like 10:10, so
okay. You got until 10. Oh man. All right. We're gonna move quick then. We'll only do a
rapid
few things
fire,
at a time.
baby.
Rapid fire. Cool. Let me share my screen. Okay. So the first one is some of the common misconceptions of the public has about us and our profession, right? And so I think um, you hear a lot of the things that the outpatient settings, the patient comes in and thinking that physical is this and that physical therapy is this and that. And so like I read some of the comments here too already, and but I want to hear you guys like kind of say what you think. Like I'm gonna read some of these comments, okay? Uh First one with this one well, let me read this first. Hey everyone, I'm a physical therapist and I co-host a small podcast and we talk about growing up in our 20s. We'll be filming an episode this week. I hope I can use my small platform as a way to help advocate for our professions, also help uh, elevate health literacy for the public, which I think it's one of the things that we try to do as well, right?
Is this
In
you,
an up
Subash, who wrote this comment? Inevitable
No, this
man.
is not me. This is not.
We
This
do
was
have a
posted
small
6 months ago,
podcast.
man.
We do have a small podcast.
We do, yeah, we do. Um, in upcoming episodes, I'll be focusing misconceptions about physical therapy and addressing some common questions that everyday people have about running, example, injury preventions, recovery, and performance. I'd love to hear from the fellow PTs. What do you think are the biggest misconceptions people have about our field? What myths about running or movements do you encounter often? Well, actually, let me say this before we go into here, read the comments. What do you guys have like anything that you want to share? Like maybe on common myths or misconceptions that you hear often in clinic?
Yeah, I'll go. Expectation around us being magicians with our hands and can fix people. I think there's
Right,
just so much of that expectation going around due to things like dry needling, insert modality of choice,
right,
manipulations, soft tissue work being so strongly tied into PT. And that's not
right.
really how I roll. So I've come across that in the clinic where it's like, okay, you just crush it. You do a great eval. You educate them. You tell them how you think you're gonna get them better. And then they're like, well, what are you gonna do to me? And it's like, ah.
Right,
But
right.
I don't know, man. That's just not really how I treat.
No,
I'm
but
sure I'm biased, I'm sure, but
evidence
I'm
also
I'm
points
not really
says
about that
it.
TL. So I guess it's the TLC expectation, and I'm not really about the TLC.
I mean, I think there are some things to say about TLCs, like especially post-op, like most recent. But like at certain point, like where do we stop, right? Like there's some evidence, but the evidence supports more of what your like plan of cares are, right? Um, What about you, Anthony?
I think the biggest misconception people have is that physical therapy is a one size fits all. And so like you get people who are like kind of sick of like, hey, yeah, I've tried the rubber bands and I've tried clamshells and bridges, but it didn't work. And I think there's nothing wrong with doing those exercises in certain situations. But recognizing that like you go to a clinic, they're probably going to be treating maybe orthopedic or neuro post-op, and that's different from treating like active population to like runners or like going to a clinic and receiving physical therapy and coaching services or physical therapy that's orthopedic or sports medicine. I think
Right, right.
that's the misconception that I would
Yeah. I
want people.
think, yeah, I think that like that what you're saying has become more evident now for me, at least like because like I used to be heavily on like yo, let's lift and do all that stuff, right? But then the more different settings like I have like encountered, right? The more you see things slightly differently. I was talking to Matt earlier about like how like being in a inpatient rehab, home health, like pediatric settings and outpatients like kind of changes like different perspective on like different patient populations and such, right? And so, no, you're absolutely right that there's no one size fits all. All right. So, with that being said, though, here are some of the comments that I thought was pretty uh interesting. The first one here says we're combinations of like massage therapist and personal trainer. What do you and no pain, no gain?
Yeah, I mean that's definitely the public perception.
I had a patient that
And when
says,
you go to PT, that's kind of what a lot of PTs will do, right? They'll
yeah,
give you a little manual and they'll exercise you. I don't know. I don't have too much issue with the personal trainer, you know.
yeah,
I
yeah,
don't
yeah,
I,
yeah.
I know some people feel really disrespected by it,
Yeah.
you know. Hey, if you're getting your patients moving and they want to call you a personal trainer,
Yeah, no, I agree with you, man. Like I had a patient that was like, oh, come massage, but then you use it when you need to, right? Here's another one that I thought it was like, wow, like, kind of I was like, well, that's not fun. And this person said, the biggest issues I've had in medical profession itself is not knowing or caring what we do. I heard a surgeon once tell a group of PT that they basically can only mess a surgical case up. He described what we did as a kind of cute add-on that patient knows it's surgery what really fixes the problem. Any thoughts?
I think that there's a miscommunication between surgeons and PTs, and it is kind of annoying that I don't know. I think that's more of this issue with our healthcare system than the specific surgeon. I understand that perspective. It's like, oh, you really don't have to do a whole heck of a lot, but like, why don't they like show up for the patient 2 to 3 times a week for 6 to 20 weeks as they're kind of trying to work back into their daily activities? Like, I don't know. It's a lot to unpack, but that's kind of my thought.
Yeah.
yeah, I mean that's only really viewing PTs as somebody you send to after surgery. So when we do more than that, so
Yeah.
you're missing the ball, man.
The other two comments, like this also kind of follows this here, right here it says, I've had an ortho nurse ask me if I had a doctorate. When I told her I did, she responded, but why do you need doctorate? You just do exercise the doctor prescribes. Oh, baby.
Damn.
Yeah. Or here, I had an insurance adjusters tell me that my patient service wasn't medically necessary because the family could hire a personal trainer to provide him his care. He was a 16-year-old with autism who was less than 2 months status post cardiac transplant who refused inpatient pediatric rehab as a part of behavioral outburst.
That sounds like a tough patient to work with.
I mean, it depends
Uh,
on who the patient's gonna kind of work best with. Like, do I think physical therapists would be most appropriate for like managing, documenting, and kind of guiding maybe the patient and the family through this situation? Maybe, but like if a personal trainer is gonna effectively kind of motivate and get them where they need to be, I mean, it's not probably not ideal versus like I think
yeah.
safety wise, but yeah, I don't know. That's tough.
Yeah, it's a um yeah, that was I thought that was like a pretty I feel like common things that we hear often like are like kind of I don't know if you guys have like encountered those, but like I feel like I've certainly have encountered one of those things. Um what here is wow, you're so good at this. You should be a PA. How did you get into this?
I mean, all right, why you're good at this, you should be PA. Like, I mean, you're asking a physical therapist to spend less time with their patients. So I
Yeah.
don't know. No, we do this because we're trying to spend more time with the patients. A PA can only really see you for five, five
Yeah.
minutes.
Um, yeah, it's um yeah. I'm gonna move on from this. Okay, I'm gonna go to the next one.
Okay.
Um, we're gonna go to this one. And this comment says there are two types of physical therapists. Those who struggle to find a work-life balance and those whose patient tolerate treatment well.
Yo, that's facts.
Do you guys want to like kind of like unpack this and tell like like the viewers like what do they mean by this? Because I feel like we talk about this a lot, just us like discussing about this.
I'm assuming they're getting at the documentation and when I first, especially as a student, and when you first come out, right, you're very thoughtful with your notes and very, you try to do the best you can. Not that I'm not now, but you think you become more time efficient, you could say, with the latter part. You cut out the fluff
Yeah.
when you're sitting at work and 40 minutes past your appointment and you still have 8 notes left.
Yeah.
You're not going to
I've
be writing a Shakespeare novel out there at that point.
Anthony, are you this which one are you?
I have five unwritten evals and I got five more today. So like I'm
Oh my
patient tolerates
goodness.
treatment well. Patient Paul, TX well. That is where I'm sitting right now.
Oh
Oh
my goodness.
man.
So I kind of want to add on more onto this that is like as a physical therapist, like especially working in outpatient settings, like we're heavily overloaded. I think most healthcare providers are, like there's just too many patients that we're seeing, or we're spending we don't have enough time to do things that we want to do, right? Which is like making sure like we document well, spend a lot of times with them. They just overbook us, and so because of that, like one of the big things that is often talked about in the profession is like work-life balance, and company will like try to market it saying like, oh, we'll give you X amount of patients and I'll give you X amount of time for you to document so that you have better work-life balance. But ultimately, like a lot of the private practices are like profit driven, so like they don't really care about much, and so this is where like the physical therapist kind of falls into this the groove of like, okay, well, if they're not going to pay me for documentations or what you guys have just mentioned, that you have a lot of documentations that's brought home, usually this patient tolerates treatment well. It's just a general term that's thrown around to bypass, I guess the insurance company accepts this so that they just you know yeah. All right, I want to move on from this. I have actually a video of this now. Okay. Adam Meakins' hot take on doctors of physical therapy on Instagram. What could this might be?
How dare he call Meekins an asshole?
Can you guys hear this?
I cannot hear it, but I feel like I've seen this before.
You can't, can you hear it?
No.
Oh shoot. But okay, so I'm gonna just gonna give you like of what he's saying. Okay. So basically, Adam Meakins is saying physical therapists in the United States who are required to have a doctorate to practice are not doctors. They are their education is not good enough to be a doctor. right? There's no research components to be a called doctor. The medical trained doctors are far more educated on the subject of human body and such to you know, to help people rather than physical therapists. And we're there. He's essentially has kind of brought the profession down, saying you should be a bachelor level professions that is treating musculoskeletal conditions for as primarily for rehabilitation. This is what he's saying, and therefore that you shouldn't be a doctor. And yeah, right. And so that's his point. And I wanted to hear you guys say because I have some thoughts on it, right? But I wanted to hear about you
Mhm.
guys' first.
Um, yeah, I mean, first of all, I like Meekins. I respect his opinion on most things. Um, really big on bending the spine, which I'm also big on. Now, as far as this, I don't know. I don't really get too much into the whole doctor argument. I don't really get too butthurt when people say, you shouldn't be called a doctor. But at the same time, we did go to school for 3 additional years after an undergrad. Sure, I'm not, don't have the knowledge of a MD, but I think we are educated to, as medical professionals, to kind of assess a patient and rule out, like, we are able to see red flags and then appropriately do what we need to do with that. So I don't know.
Anthony, you want to say add on to that?
I guess devil's advocate. I don't have anybody call me doctor, and I don't know that I would. I'm never. I don't know. I guess it's not commonly practiced to have somebody call you doctor. I know there's some cash-based places and or there's some physical therapy clinics that like people go by doctor, physical therapist. I think it can be good. I think that there's a certain like level of knowledge that needs to be upheld and like maintained to be a doctor. And so like an MD is going to continue to learn. And the expectation is that a physical therapist should also continue to learn. So if that's the culture we're trying to promote, then I mean I don't disagree that we have a doctor. And I think maybe it's just more of our it holds us to a higher expectations. And I don't think that there's anything wrong with that.
Yeah. I want to add more onto this. Okay. Like I mean, obviously, first of all, like, Adam Meakins, he's a goat, right? On certain things. Internet goat is what I would like to say, right? On in terms of because like some of the things that he shares like a lot of non-BS kind of things. Here's what evidence says, right? Versus like I mean like we even talked about this like when we were starting this whole thing was like we see a lot of if you have this, do this to fix it kind of culture, right? In Instagram. And so Adam Meakins coming in and saying like, hey, dude, that's not it. That's not what we do, right? He had a huge beef with like Squat University was like saying like favor special tests would like treat your hip pain, knee pain, headache, and all the above. He's like pretty much picking like saying that like that's not it, man. Like you shouldn't be doing that kind of thing, right? So in that regards, like I respect him. Um, but and also I think what you guys are trying to say is that like, we don't advertise ourselves as a doctor, like, and that we don't necessarily care. I don't think anyone in our profession says that like, oh, hi, I'm a doctor, this, right? A lot of the times we're just there to treat
I
patients.
mean,
We're
I
there for our
know
patients.
I know some PTs who will introduce themselves as doctor.
Do
I
they?
don't.
Yeah. I feel like, does the title of doctor matter, right? Like, because like the way I see it, one thing is like when introduce, I've noticed this too. Like when I introduce myself as a, hey, my name is, Subash. I am a physical therapist. I'm here for you, right? I'm here for you. That leaves an open up, uh, just kind of like creates this trust between you and patient, allows you to open up more for them to you, right? And which will give you better history. Um, versus like, hey, how are you guys doing? My name is Dr. Subash Guru. I'm a physical therapist and I'm one of here. And versus that like kind of like comes in as like a big wall and kind of prevents your patients from not opening up on certain things, right? And so, in that regards, like I think that it's just better to just say call my name. And so, like, I don't really care about being called doctor or not, but we do have our doctorate. We did like, like have Matt said, like we went to school. One of the prerequisite to be a physical therapist is you got to have your bachelor's degree, right? And go additional 3.5 years of school and training to be get our credentials, right? And all the programs that in the States are credentialed by the higher, I think CBA, something like that, right? That is a whole credentialing process that allows us. And one of the credentialing process for that is to like make sure that like there is a research component of it, right? And that or whatever we're doing is that we are creating a new generations of physical therapists that are tailored on evidence-based practice, right? And so like all of that our education is tailored towards that, so like I feel like our educations like he when he says something like that is like he's discounting on our abilities, our education, right? I mean, do I care like if I call doctor? Do I care if I call masters, if I have bachelors? No, I don't, right? But what we do have is like a very good education that has prepared us for really, really well to be able to treat patients and on musculoskeletal conditions, right? How to progress them well of injury preventions or like post injuries and things like that. And so treating pain, neurological conditions, right? Like I think that there aren't any, and research have proven this over and over again too. Like there aren't any other field. Regardless of like whether they're physicians, right, and things like that, like that we are just because this is our specialty that we are better at rehabbing than they are. And so that's what I wanted to add on to that.
I got one more thing.
Okay.
I think that, I mean, yeah, so we are in a great situation to work with patients, but we're also a community like educator. We're there's a lot of different roles that PTs have. Besides from that, I also think that doctor of physical therapy is fairly new, and we're
Hmm.
probably going to see more of the masters of physical therapy. I mean, retiring and or I think being less common in the next like 10 to 15 years. And what's to say that kind of the trend isn't that more people or more physical therapists don't go by like doctor in the future so that they kind of show this is the
Right.
education. It is marketable and it is, I think, important to show,
Hmm.
uh, but it just needs to be consistent. So if you go to a practice and like one physical therapist who's a doctor introduces themselves as first name versus last name and it's not consistent, I think that could have a little bit of a that wouldn't probably be good for general patient rapport.
Right. Yeah. No, I agree. I agree. All right. Let's move on to the next one. Um, there was an article that came out like like what 5 days ago, July 11th, right? That said physical therapist dies inside hyperbaric oxygen chamber at his Arizona facility. Um,
What even is that? What is an
Hyperbaric oxygen chamber, it's a tube filled with if I'm like understanding this well, right? Because I did do a little bit of digging, is that like it's a uh pressurized tubes filled with oxygen, right? And this is used for wound treatment a lot of the times, right? Yeah, like if it's in there's infections or something like that, right? Just like purely oxygen to like help accelerate the healing process, right? And sometimes they people use this as a means to like, I don't know, some like rejuvenate their skins or rejuvenate there's a whole like they say like there's a health benefits by doing this. But oxygen by itself is highly flammable, right? And so if there's any sort of even a small spark, then it causes a fire. And so it's very dangerous, right? And so I don't know if you guys like know like when there's like Um, like have you used like the like a fire like a place that you heat, right? And so like when
I've
you
seen fireplaces.
right, uh, like when you burn a wood in a fireplace, that you control oxygen to, uh, you know, increase the intensity of the fires or decrease it. Eventually, like if you want to put it out, you just close the lid, it shuts out the oxygens on that, and then the fire dies. Versus if you open it up and you fill it with oxygen, the fire keeps going until I guess there's no more wood. But so yeah, that's what happened. So this happened in like uh before what was it like July 10th? This happened July 10th. Firefighter was called into the scene. He was in the hyperbaric chamber. They're not sure what caused it, but they're still investigating it. And apparently, this guy was he had just opened this practice in 2014, focusing on like hyperbaric therapy. Which I think we have to look more into that. Like, what that does that mean? Rehabilitations, nutrition guidance, and biohacking services, I guess. I don't know what that is, right? Um,
Mm,
but yeah, so and apparently he was also like a mascot for the NFL Arizona's Cardinals. This dude. Um,
really?
yeah.
Damn.
And yeah. And then the other things like apparently in the same, oh no, January in Michigan, a 5-year-old died similar to like this incident. What happened? I don't know why they were using a 5-year-old for that. Like I didn't look into it. But that resulted in their staff members with the criminally charged. Like they were staff members were criminally charged that were 5-year-old died because of the similar incidents. So I don't know. People like in our professions, like I think there's like still gurus that they use is like, different things like modalities for example, or certain things like, to sell on the services, right? Because like basic education and exercise and progression is very boring. You know what I'm saying? And versus if you use the word like hyperbaric therapies or like biohacking services, whatever, it's like more marketable. And so I
Of
don't know,
course.
like just wanted to share this with you guys. I don't know if you guys have thoughts.
Um, yeah, that's kind of sad, man. RIP, but
Yeah.
I don't know. I guess stay out of hyperbaric oxygen chambers. I wouldn't have one in my clinic. I don't know
Yeah.
what the evidence really
I
says about it, and I doubt it's compelling.
yeah, I think there are some evidence for like using for a wound because I know they use it for like in wound care and infections control and things like that. So I'm not very familiar with it, but I know they do.
Hmm.
Any thoughts, Anthony? And then I'm gonna move on to the last one after this
Yeah.
one.
I think that hyperbaric chambers are not a something I know a lot of, but I wouldn't say I wouldn't want to give my, I guess, opinion on them beyond just my personal experience. Like I've used the hyperbaric chamber before, like when I had lost hearing in one of my ears, had an
Mhm.
infection. So like later on, after trying some like we tried to see if I could help like some hearing, regain hearing using like a I don't know, it was like a some kind of injection. I probably should be more educated about it, but I kind of just went to the ear, nose, throat and was like, yeah, I'll go check the boxes and just, I don't know, I was kind of not, I was checked out about it. Um, but I went to hyperbaric chambers and you go, it's like you go once a week, twice a week.
Mhm.
You sit down you lie down in a chamber for an hour or a little longer and they pressurize the chamber, and then you just kind of like let it do its thing. And I can't say much more beyond like what I know of my own modalities of like I mean I work with e-stim, ultrasound, um, eat modalities, but like hyperbaric is like I guess if this guy knew what he's doing with them, it's really sad.
Yeah.
But I can't say like I know much about it and from the use of a physical therapist practice. He could have just been I mean, I don't know. Did you see if was it something of his own? Like, was this his own physical therapy practice, or was this like,
Yeah, this was his own practice.
because he could, if he's working in a hospital, then like there's a chance that maybe he was just in the hospital system and using their hyperbaric chambers. But you kind of need somebody who's trained in using these in order to
Yeah.
use it.
No, I think the article said it was his own practice that, or like, yeah, something like that. I at least hinted that it was his own practice because he had just opened it up. Like, um, okay, not yeah. This is not cool. Like, RIP, my dude. Because that's sad. But I wanted to show this before I pulled the other one up. Uh, this is the last one. From this intricate art spine and body solution. I guess it's a private practice or something like that. I looked into it, their website a little bit, and all of these people that's doing this are physical therapists. And this was written by one of the physical therapists, okay? And the title is Dry Needling for Erectile Dysfunctions, Incontinence, Vagus Nerve Stimulations, and Men's Public Health. Um, what do you guys hear when you see this title?
I don't know anything about pelvic floor or beyond what they taught us in our class, so it's not something I continue to educate myself on. So
Mhm.
I'd probably need to look more into it in order to give like opinion. I'm not a dry,
Well,
I don't do dry needling in my own practice yet. I
mhm.
may be good for
Well,
muscular.
yeah. So I want you guys to just explain it based on your knowledge on it, okay? From as much as you know. I know Matt has dry needling certifications. All right.
Yes, I do not needle for patients coming in with complaints of erectile dysfunction, thankfully. I wouldn't have much interest in that, but yeah, I do. I have a needling certification. My company is big into it, so I was not forced, but strongly encouraged to do it as a student. So I did it. Um, you know, I'm not a huge dry needler. I think the evidence, like most things, is pretty mixed.
Mm,
And then I view it the same as any sort of. Well, this isn't really to do with that, but that's just my thoughts on needling.
yeah.
But yeah, I don't really know much about this.
Yeah.
Maybe there's
All right.
evidence for it. I'm not.
Yeah.
I,
Let me show you this article first. And well, I guess hold on. I don't want to say article. Let me show you this. I'm just gonna scroll through it, right? And when you see this, right, I want you to tell me what does your thought come like, what do what one of the few thoughts that comes into it because I'm sure if you see it like your thoughts come in, your mind goes towards that directions public also goes through their directions, because they're less educated on certain things or how to
how are we
read
going to
articles.
stimulate the vagus nerve would be my question.
Yeah.
How do they
Um,
explain? Yeah.
oh, I'll talk about it in a little bit. But here's what you see, right? This is the title, it has the introductions on it, long introductions, and it says describes what vagus nerve is, then what erectile dysfunction is, incontinence. He has like added like his own pieces on like, to accomplish this and all that stuff. This is how he's do it, done it, public health, and um, and there's a research reference post at the end. So when you see this, right, what does your mind go towards?
I'm not going to read it and try dry needling and just see if it works.
Um, my mind says I wouldn't want people poking with needles down there.
Well, so where I was going with this was
What my
like,
mind says.
where I was going with this was like, like if someone saw this, right? If a person that was looking interested in looking at this, right? A public was, they will look at it. Oh, hey, there's a great articles that the awesome efficacies of, right? thoughtful dry needling and joint manipulations and resolve pelvic impairments via autonomic nervous sound system homeostasis. So like when people look public reads this our title, right, they're looking like, oh my God, this is an actual real article, right? And so like when in reality it's just using like bunch of jumbles like words that like just says things, right? And there's an abstract, kind of looking like an abstract, right? There's an introductions, there are some subheadings in there, and at the end of it, right, there's some references there, right? And they've even put
Right.
disclaimers in there, right? And so they're looking at this like, oh, here's a real article, you know,
Yeah.
real article. And what do we know about articles? Is that like from our experience, is that like there's a real articles and there is a BS article that has just been submitted. This is if you don't know how to like discern this, is that this is a blog post, right? It it's a blog post, and like and written by Jason, who is one of the clinic owner, right? And from our knowledge of like how to write an articles, and any times like if the author has anything to do with financial like and ties to this, there's a huge bias already, and that should already be thrown out, right? But public doesn't know that, right? And so it's
Yeah.
heavily misleading to say something like this. So that's where
Yeah, and
my
there's
head was
articles
mine.
too. So when
What's
you read
up?
through it, you're like, oh wow, there's research at the bottom. You're like, oh, look at this. Let's support it. You know.
Right.
And if you're not able to, not that anyone would do that, but actually pull up the studies and discern that,
Hmm.
you're not gonna be able to quite understand. I mean, even there's a lot of big words, right? Like just that, they start talking about autonomic nervous system homeostasis. How many people know what that even means? They're like, but they're probably like, oh, that sounds cool.
Right. And so, and how many times have you guys heard in clinic that saying like, "Oh, I did my research on this, and it said that this."
Yeah, right.
Yeah. Right. And so, Anthony, do you want to add anything to say to this or?
I guess if I definitely agree with you. I think like they should probably find some way to incorporate maybe more evidence-based practice. This not doesn't seem most transparent, and I guess if you are like really struggling with this, that maybe people will be willing to read this all the way through.
Mhm.
But I think it's, I mean, my thoughts are, I can't really speak a lot to it, but maybe beyond just is it risk to benefit ratio? Is this something that's going to be super risky versus like if they're going to be taking
Well,
some type of
your mind is going in a logical thinking because you're aware of what that is, right? Risk to benefit ratios like or like even calculating those. You know of that versus like what you just said. If someone has been struggling with this, do you think they're going to be thinking about these?
I think dry needling is a low enough risk that like, all right, if this is something that somebody finds helpful, like okay, but like I'm not going to be practicing this, and I would say like maybe it'd be good to get somebody's perspective, like as like a pelvic floor specialist, but just like a psychological perspective, like okay,
Yeah.
no more
So
different than dry needling for like musculoskeletal, I
yeah.
guess.
So he doesn't specifically say this. I mean, I skimmed through this article. He doesn't specifically say like dry needling the nervous systems, right? He implies. So actually, let me kind of say like what he's like on he's targeting on. So a couple of things he's saying like uh you know what autonomic system nervous system is like something that regulates our body like without us thinking about it, right? Just do basic functions. And saying that dry needling can quote unquote reset depending on how you target that. Like if you find a specific, muscle, right? You can also do like a dry needling and joint manipulations to help reset because it releases this endogenous like hormones to relax our body, saying that's a form of treatment. He argues that like which like relying on medications, which is a valid point, right? Over reliance on medications, you should try something else. Um, he says that we are not aware of men's health. as much, right? And the APTA needs to do a better job on like learning, or like in promoting men's health, which is another valid point, right? Uh, and then so it's vagus nerve simulations, using that to like stimulate the parasympathetic nervous systems, right? Autonomic nervous systems, by dry needling it. And so he kind of implies he doesn't explicitly say that we're going to dry needle the nerve, but he implies that dry needling the nervous system, or the ear, where your vagus nerve has some of the innervations part of it there, right? And saying that like to stimulate the your vagus nerve, pretty much, that does a lot of rest and digesting, relaxations, so that you're not um quote unquote overactive, stimulate sympathetic nervous systems, which I think the premise is that like he's saying that like people have like all of these conditions because there's a hyperactivity of like sympathetic nervous systems, right? Which is like, just, I think the most basic way to understand it is when people are say like, okay, fight or flight, when there's something dangerous coming out, your body tends to like, preserve and stimulate vasodilations, or like expanding of blood vessels, to make sure you get the most enough amount of like nutrients and oxygen is needed, to increasing heart rate and increasing breathing rate, to make sure that you are give as much chance to survive as possible. And they're saying that like his premises are like they're in those hyperactivity, and therefore we need to use a vagus nerve stimulations, um, to by dry needling it to lower it down, is what he's saying, right? And I looked up like what the heck is vagus nerve stimulation, right? I didn't know that was a thing, and so I looked it up, and there is a thing. There's a new upcoming, I guess a research that when people have hypoactivity of vagus nerve, which I've had a couple of patients with that conditions, where it leads them to like having issues with heart rate and such, and so they usually like they pass out, right? I've had patients like that, and
That's
so
POTS, isn't it?
yeah, 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 yeah. Right. And so, and
Not necessarily.
um, yeah, I think they fall in the similar line. There's like a different forms of it, right? But anyway, but my point being is like that, like if there is a something's wrong with the vagus nerve, if you stimulate it, then you wouldn't have those problems, right? So there's research ongoing, and FDA has approved some protocols to do that, right? But we don't know the full effect of it. And so he's just pretty much saying like, oh, this is what's gonna do, without like really having a data supporting any of that stuff, right? And same thing goes into like erectile dysfunctions, pelvic pain, um like incontinence and all of this. So, and ultimately he's arguing it's like you should do dry needling joint manipulations to restore quote unquote homeostasis, which means like bringing it back to your resting state, right? Which is normal. Um, so yeah, and he doesn't explicitly say it, but like he implies you should get dry needling heavily on to fix all that stuff. Yeah, I just wanted to share this because like I feel like general public just we yeah.
I,
Yeah,
I like the points you made about the kind of looking at like biases, and I thought that was really good.
because like we get it way too often that patients are coming to our clinic saying like, "Hey, I've done research on this," and so like because when they're talking about research, what do you think they're looking at, right? And so when there's no efficacies, there's no methodologies, it's not peer reviewed, it's not data driven. There's none of these stuff is presented.
Yeah, it's the information age. Here's what I'll say. I will say I've noticed a lot of gym bros. This has nothing to do with dry needling. This is a totally
Uh-huh.
different. Um, this is just about information being out there. I've noticed a lot of gym bros who aren't necessarily scientists by any means coming up to me and mentioning Mike Israetel, Jeff Nippard. So there are, and that I'm encouraged by that. These people are, obviously I'm a little bit biased, but in my opinion, putting out really good information, science-based information, and they're becoming really big. They've been on podcasts like Chris Williamson's podcasts. I think these big major podcasts. Maybe I don't know about Rogan and stuff like that, but um, my point with this being, there's some encouragement in the exercise science, in the bro science lifting video worlds, with people getting exposed to better information.
I yeah, I definitely hope that like we educate and like transition into like this world of where like people are doing better services like educating the public and dissecting this age of informations and how to find the most reliable informations that is going to help them rather than just looking things up in like Google search. Like different things, but like I have students like that say, oh, I researched it and to looked up something, and usually when they say they researched it, they Google search it and here's the answer. I'm like, and I often have to say like, do you know what they mean? Like, do you can you tell me what do you think this is? And they're like, no. I'm like, exactly, because you didn't do a research. You just asked the question on Google and Google spit out an answer for you. But anyway, so that's the end of it. I don't know if you guys have any more thoughts on it. Thank you, Anthony, for like sticking out. Like I know you said you had to go. I apologize, man, for like if I'm keeping you over here. We're
Ah, you're
going
good. That's the one
overboard
to finish
here.
up.
Yeah.
I do want to go train though, so I'm about to hop off here.
Anyway, so thank you guys for listening to our podcast. Another just kind of I thought it was a unique opportunity for us to like do something different. And those small number of people that's been listening or following appreciate it. Have a wonderful rest of the day. Bye.